Well, welcome back to our discussion on the shoulder and shoulder injuries in women. I'm here with Dr. Q and Dr. Woolridge. And let's move our focus now to shoulder instability. So, Dr. Q, can you just give us a tutorial on how the shoulder joint functions?
Yeah, absolutely. So the shoulder joint is made up of two bones. So the glenoid is the socket, it looks like a golf tee, and the ball is called the humeral head. And so those are the bones of the shoulder. And the shoulder is a ball and socket joint, but it's inherently very unstable. It's just a golf ball and a golf tee. And so you can imagine there's a lot of wiggle room for that ball on the golf tee. So there's different types of stabilizers to help stabilize the shoulder. Some of them are static, meaning they're just stuck there holding, including the capsule, the ligaments of the shoulder, but there's also dynamic stabilizers. So muscles that stabilize the shoulder. The bicep tendon helps to stabilize as well. And all of these are very complex interplay to help stabilize the shoulder. And probably one of the most talked about stabilizers is called the labrum. The labrum is this little tissue that is around the shoulder socket, and it helps to deepen the socket and helps to create a bumper around to help the humeral head stay in place as you're leading your life and being active. And so a lot of complex structures are going in to help balance this golf ball on a golf tee. And as we talk about instability, we'll identify which structures commonly get injured and how a shoulder can become unstable.
So it sounds like it's sort of inherently unstable. Where's the line between shoulder instability and a normal shoulder motion?
So there is general instability in terms of comparing the shoulder joint compared to the hip joint or to the knee joint, where there's just more bone-on-bone contact, and so the joint itself is more stable. The line in terms of functional instability of the shoulder compared to just this joint compared to another joint in the body is more related to, is this shoulder joint actually starting to slip out of place? So, for example, a dislocation of the shoulder or something we call a subluxation, where it sort of slips out of place and comes back in. That is something that we worry more about because of the potential damage that can cause to these structures in and around the shoulder joint. So that is the difference between, oh yes, this shoulder joint is inherently unstable, there's just not a lot of bony contact to hold these two bones together, versus is that actually functionally an issue for our athletes or for our active people, where they're actually experiencing separation essentially within that joint.
Yeah, it really only becomes unstable when there's a traumatic injury where the shoulder actually comes out of socket and comes back in. The shoulder itself, living your everyday life, yes, the golf ball is balancing, but it's balancing because of what the body was made to do and help stabilize it. Any pathologic or bad instability is usually related to a traumatic event where the shoulder comes out of socket, those stabilizers get damaged, and then there's subsequent instability or a risk of recurrent instability.
And is shoulder problems in general and instability specifically, is that more common in women?
There's two different flavors of instability. One, like I mentioned, is traumatic. The other one is called multidirectional, meaning that some patients are born with the loose capsule. We've talked about the capsule a lot in this series. It's just the balloon around the shoulder. And some patients just were born with loose tissue. And so that tissue is supposed to stabilize the shoulder, but it's loose in some patients. And so that has been shown to be more common in women. Usually in my practice, I've seen a lot of more the traumatic instability in male patients. They're the ones who get traumatic injuries from sporting events or they fall while they're skiing. Of course, women can have these as well, but I have seen a lot more men who have these traumatic instability episodes. But anybody who's active can unfortunately sustain a shoulder dislocation from any fall on the shoulder. Usually outstretched like this is the position of risk. Sometimes the shoulder coming out the back is way more uncommon, or way more uncommon. But the most common way it comes out is out the front when the arm is out in this position in some sort of traumatic event.
Got it. What are common risk factors for shoulder instability?
Yeah, so definitely what sport you are playing. And so more of the contact sports there's just more of a likelihood that your arm will be bent in this awkward position and somebody will hit you or hit your arm, leading to a dislocation occurring. In people who have hyperlaxity, meaning that the ligaments that hold their bones together are very loose. I'll try to actually demonstrate for this patient because I have some degree of hyperlaxity. So you can see
Oh,
here the ability of me to
wow.
do that. Yes, not normal.
As
So
opposed to this.
Yeah.
exactly. You're like, let's demonstrate what
So you
normal
know,
looks like.
just so you know.
Exactly. So that's a very easy way. I have a little cheat code in my own body to demonstrate to people, like, what does it mean for your ligaments to be loose? That means that you get a lot more motion through different joints than other people would. And so then you're potentially at a higher risk of things slipping in and out of place. And so I have a lot of patients who come to me with in their 30s or 40s, a lot of women with a lot of chronic shoulder pain and discomfort, irritation of the muscles around the shoulder, maybe small tears in the rotator cuff or in the labrum itself. And these are often women who tell me, oh, when I was younger, I could do this party trick where I could sort of like pop my shoulder out and pop it back in, or, I could bring my shoulders way up. I can't do that, but I can way out, like do the full 360 around their head. Or they tell me, I had lots of episodes when I was playing my sport where I felt like my shoulder kind of popped out and popped back in. And that unfortunately can create a lot of like micro trauma inside of the shoulder, which I've found in a lot of my patients as they get a little bit, beyond their active, sports years and their high school or college years. They come to me with just a lot of chronic pain. And what we do commonly for those patients is a lot of physical therapy to try to strengthen up the muscles around the shoulder to provide some of that external support. And sometimes that helps, but sometimes, again, there's just a lot of micro trauma that's built up over the years that may need a surgical evaluation to try to heal any damage that's been caused over the years.